I'm Lucy Virts and I'm a consultant clinical psychologist. I work alongside the children's kidney team here. You see children and young people in all different situations when you work in a kidney team because there are so many different stages of kidney disease. I get to support children who are going on dialysis, children who are going through transplant and after that. And yeah, it's a really interesting job and I love it. As part of my job, I try and support families, caregivers, parents, as well as children, young people. And I think when children are being prepared for transplant, the focus is very much on the nuts and bolts of transplant and all the complications, medical, psychosocial, everything. Like, for example, when a parent donates to a child, the parent is in one hospital and the child is in another. And sometimes the parents that's donating can be the main carer for that child. And they both want to be the donor but also want to look after the child. I just love working with children because children see things differently from adults, and if you can enter that world and support them through it, you can make a massive difference. When they're being prepared for transplant, they look forward to just eating normally or being able to go swimming. Whereas, a parent will be very focused on what's going to be happening in 20 years' time or 30 years' time. But you ask any child why they want a transplant, it's usually so I can eat pizza, chips, so I can go swimming, I can go on holiday. It's about, being playful about really serious things. The hard stuff is seeing the impact that illness has on children. It's hard seeing that with families and seeing the change. And I think because society generally doesn't have a good understanding of kidney disease compared to perhaps other conditions, people can be a bit dismissive and not realise, because often the kids don't show any visible difference. It's not like they've got a leg missing or something where people go, oh, okay, I can see what's happened to you. And I think children and families feel isolated generally and different with kidney disease. School is disrupted, kids who might want to be going to sleepovers and things can't do stuff like that. No kid likes having blood tests, who would? But it can be a 2-hour screaming match or it can be a 2-minute little bit of an unpleasant thing. And if we can use psychological techniques and distraction and relaxation to help children cope with it, to make it a very small part of their life, then I feel like that's a good job done. But what we usually do is support parents to then support their child to do that. One of the hardest things for parents is that when there's a health diagnosis, a disease diagnosis, that parents feel very de-skilled and they feel like their previous parenting almost doesn't count. And that's one of the saddest things for me to see, when parents sort of feel like, now what do I do? And what kids need through this journey of illness and treatments and things like that is they do need the really normal parenting stuff. They need, fun, they need boundaries, they need routines, all those things that help children feel secure. And a lot of our work is about supporting parents to use their previous strengths, use the things that were going well in the family before and reinstate those. Seeing how resilient families can be through these circumstances is amazing. So I think it's about perhaps taking the time sometimes and thinking about how is our family going to live alongside this illness, not be defined by it. I feel like that's what most of my work is about. It's not about making the illness going away, and I haven't got a magic wand. That's what people would want, but I haven't got that. But it's about how do you live well alongside that illness at different stages in your life.